thank you so much for joining our joint fourth webinar with P2P, in which we really have been focusing on healthcare especially within the healthcare education space, given that AI is now a reality. And in healthcare, there have been sort of several healthcare is a data-rich space, has lots of opportunities for AI to make it more efficient, more effective, and for us to provide better care and better products, to clients and to patients, around the world. So, which is one reason why we decided to jointly do this with P2P to help share this information, especially with academics or folks working in the Africa space, and looking at how AI can actually affect education by providing both more healthcare workers in many countries where they're needed, but also providing better trained healthcare workers where they're needed. Today, we'll be talking about AI in the healthcare space and AI in the research space. And we know that many people are worried about what role AI might play, especially in the future, regarding healthcare professionals. But we believe that, for us to be able to influence how it affects the space, we need to have several, you know, healthcare professionals and trainers of healthcare professionals need to understand how important and how this might be. And for many of the young people, they're already using AI in other spaces. And we think it's so important for healthcare and African healthcare academics and professionals be important, take an important role in shaping how this affects the continent. I will come back and introduce the panel, but I'm going to hand over to Dr. Mehari, who's leading our partnership with P2P, to make several comments. Dr. Mehari.
Oh, thank you, Dr. Egbe. Good morning, good afternoon, and good evening to our distinguished colleagues and friends joining from across the globe. It is my great pleasure to welcome you to this important webinar jointly organized by Anandach and People to People. This initiative builds on a strong and meaningful partnership, one that proved its value during the COVID-19 pandemic, when together we created a platform that connected experts, informed policymakers, and supported communities across Africa. Today, we gather at a pivotal moment. Artificial intelligence is no longer a concept of the future. It is actively shaping how we deliver healthcare, educate our students, and conduct research. For Africa, this is not just an opportunity for innovation, but a strategic imperative to leapfrog traditional barriers, address workforce shortage, and build resilient, forward-looking systems. At People to People, we believe in the power of people solving people's problems. Through partnership like this, we aim to build bridges of knowledge, empower the next generation, and ensure that Africa is not simply a participant, but a leader in the AI-driven transformation of healthcare and education. Today's discussion brings us together leading experts, clinicians, educators, and innovators. I encourage all of us to engage actively, share perspectives openly, and think boldly about how we can translate ideas into practical and scalable solutions. Together, we have the opportunity to ensure that technology remains centered on humanity, that artificial intelligence augments rather than replaces human wisdom, compassion, and judgment. Thank you for taking the time to be part of this journey. Together, we can shape a future where technology serves humanity and where Africa leads with purpose, innovation, and collaboration. Welcome, and I look forward to rich and inspired discussion. Thank you, Dr. Elbe. Back to you.
Okay. Thank you so much, Dr. Mehari, for those comments. And I'm very delighted to introduce the first panel. But before we do that, just a couple of housekeeping rules. If there are any questions during the discussion with the panels, please put them in the chat, and the moderator will try as much to pick up as many during the time limited. The other issue, Jamie, please can you put the Survey Monkey link in also the chat so that everybody can see? We are also doing a survey just to understand, especially folks who attend, what's, where you are in the AI space at this time. So we really would appreciate your if you could please fill in the survey that so you can see where we're just trying to understand where people are in the AI space at this time. But so thank you so much for joining us. I'm very delighted to be able to introduce Dr. Abimbola Famuyide, who is professor of obstetrics and gynecology at Mayo Clinic, Rochester, Minnesota. Um, Abimbola, we're very lucky to have him as a moderator. He's a gynecologist by clinical profession, but he's also um, a leading a leading professional light in both the American College of ONGs at Mayo Clinic, where he's also on the board trustee. But also very important for this session has been actually doing very cutting edge work on AI in the ONG space. So we're very fortunate to have Dr. Famuyide as the moderator of the first panel. And he is going to be joined by an amazing group of panelists, and we're very fortunate that they have made time to join this event. And so we have on the on this the panelists include the panelists for this event include Miss Eva Guban Andrews, who is the CEO of Prediction. Eva is an engineer and an experienced healthcare executive, both in the global health and pharmaceutical space, and has worked across both Africa, Asia, has worked across basically globally, Africa, Asia, Europe, and Latin America. But why she's here, particularly, is that she's leading an amazing innovation in the anesthesia space. And for folks who have been in the surgical room or maybe some anesthetists on, imagine if you could tell if there will be a disaster, 10 minutes before it happens. What can you do? And so Ava is leading an innovative company called Prediction, which was founded by an anesthesiologist who also has, I believe, a double degree in engineering and has been able to look at real data from a hospital in Spain to come up with this company. But Eva obviously is much more eloquent and will tell you much more about this company than I can. We are also very fortunate to be joined by Miss Yoko Shimada. Yoko is an amazing scientist, but importantly, she's an economist and has a lot of experience looking at data. And she works for the Center of Digital Health Innovation. And really, when you talk about AI, you must talk about the issue of data and how do you collect data so that this can be actually useful. So we're very fortunate to have Yoko, who has had experience in advising governors and partners across Africa, Asia, and the Middle East on digital transformation and how, and across health finance and health strengthening, but really thinking about how you can use data, on how you should collect data and how you can use data to build a solid platform for AI. So, welcome, Ms. Yoko. And then the third person on this panel is Miss Barbara Salami. Barbara herself was a C-suite member in the pharma space, but now she spends her time advising folks on um, AI fluency and adoption accelerator. And and she's really been she's really has an innovative way to really get in the importance of AI across to different communities, especially in the healthcare space. And I believe she started working recently with some companies or with some groups in relatively low resourced environment, thinking about how you can use AI to improve the healthcare and the health products that you provide. So without further ado, I'm going to hand over to Dr. Famuyide, who will moderate the session. Please remember any questions should go into the chat box. And also, please remember to fill the survey. We really would appreciate your perspectives on where you are in the AI space. Thank you so much to the amazing panel and the moderator. Over to you. Thank you, Dr. Famide.
So, Dawudu, so thank you to you and your team and to P2P for organizing this webinar. And thank you to my fellow panelists for making the time to share with this group. If I may ask Ms. Shimada the first question, given the depth of experience that you've had with your team in studying the financial and economic impact of digital technology interventions in low-resourced countries. As you know, there's now a strong momentum around adopting AI in healthcare. But there isn't always clarity on what the added value is. So if you could just share with this group how you think countries that want to dip their toes either into digitalization or maybe they're already digitized and now they want to adopt AI, how should they go about it? What are the key considerations and what criteria should guide those decisions? I don't know if Ms. Shimada can hear me.
We can hear you
We
well.
can hear you.
Can you hear me well? Is she on? Is she actually on?
Maybe you could go into the next question.
Okay. I mean, I see Miss Eva Garvin Amfrans, right, joining from Barcelona. Oh, but I see San Francisco behind you.
That's correct. Yes, one can dream big. Yeah.
That's terrific. So,
not that Barcelona is not beautiful, but
no. Well, thank you for joining. I looked up the website of your company, and I was impressed with the mantra. You can't prevent what you can't predict. So could you just explain to the group what Predicton is all about and how you use artificial intelligence to support anesthetic decision making in real time?